Hello, my name is Aubrie. I'll be your student nurse today. So we're just going to be doing a physical assessment. It's a review of all of your body systems, making sure that they're all functioning properly. I will have to touch you throughout the assessment. Is that okay? Perfect. Now I'm just going to check your name badge, make sure that you are you. Can you say your name and date of birth?
Lindsay Sims, October 25th,
Perfect. Oh, sorry, I interrupted you. Do you have any allergies?
No.
Okay, wonderful. So now I'm going to go ahead and put on some hand sanitizer. I'm going to pull the privacy curtain to ensure privacy for the patient. All right, now I'm going to have you come and sit on this bed. So as she's walking, I'm going to assess her gait, making sure that it is nice and steady, making sure that she's not limping, she's not shuffling. I'm also going to assess her posture. She's nice and erect. She's not slumped over. Now I'm going to assess her hygiene and her grooming. She looks well kept. There's no presence of any foul odors. Maybe. Just kidding. There's no presence of any foul odors. Patient looks clean. Now I'm going to assess for any signs of illness, and the patient isn't giving me any nonverbal cues to show that she's in pain or that she feels sick. Her posture is intact. She has easy respirations, and her attention span seems to be not too short. All right, now I'm going to assess her skin color. It looks like it's a nice pink color. It's evenly distributed throughout her body. So now I'm just going to go ahead and assess her skin in general. So first I'm going to inspect the skin, making sure that there's no visible lesions, no bruising, there's no visible presence of edema. Her skin is well vascularized. All right, perfect. Now I'm going to palpate the skin. And normally I would raise the bed, I wouldn't be going to the ground, but because this is my room and I don't have a movable bed, we're just gonna do this. So now I'm going to palpate the skin, feeling for any warmth, feeling the temperature, feeling for any moisture. So her skin is nice and warm, it's nice and dry, the texture is nice and smooth. There's no presence of edema, there's no pitting when I apply some pressure. All right, now I'm gonna do the same here. I'm gonna assess her skin. It's still nice and warm, dry, no presence of edema. Now I'm going to check for turgor. So I'm just going to pinch right at your clavicle. Perfect, and the skin is elastic, so that was great. So you are well hydrated. All right, now I'm going to look at your nails. So if you could go ahead and give me your nails. So I'm looking at the shape, looking at the texture. They're nice and smooth. They are concave. The angle is at least a 160-degree angle. Perfect. They're not brittle. They're not cracking. I'm just going to assess her capillary refill. Perfect. So it's white and then goes back to pink, which is good capillary refill. And here as well. Okay, now we're going to look at her toenails as well. Also feeling for the texture. They're nice and smooth. They're concave. There's no clubbing on her toenails or her fingernails. I'm going to assess the capillary refill again here. Okay, perfect. All right, okay. Okay, so now that we have assessed her skin and her nails, we're going to go ahead and assess her mental status. So first, I'm going to assess her awareness and her orientation to person, place, and time. So do you know your name?
Lindsay.
And you know where you are?
Your apartment.
Do you know what time it is?
11.
Okay, it's around 11.
Ish.
Yeah, ish. Okay, perfect. All right. So now I'm going to assess her level of consciousness. So she's awake, she's responding, and she's able to follow my commands. So I'm going to rate her a 15 on the Glasgow coma scale. And I'm also going to assess her overall affect, attitude, and mood. So patient is smiling, she appears to be happy. My Siri just went on. And so she has a positive affect and mood. Okay, now I'm going to assess your memory. So I'm going to give you 3 words that you need to remember later.
Mm-hmm.
Okay? Car, rabbit, doll. Okay? So remember those 3 words, and I'm going to ask you them later, okay?
This is not what we practice.
What we practice
Car, rabbit, doll.
Car, rabbit, doll. Okay. All right. Now I'm going to assess your language. What's your primary language?
English.
Perfect. And she is fluent in English because she's able to respond to me. I'm able to understand her. And she is not having trouble responding to my questions. Okay, now I'm going to assess her ability to for abstract reasoning. So if I asked you, or if I said it was raining cats and dogs outside, what does that mean?
That it was raining super hard.
Perfect. Okay, so she gave me an abstract answer, not a literal answer, so she's able to do some abstract reasoning. All right. Now, just making sure I didn't forget anything.
Rabbit doll.
Yep.
Okay.
I didn't ask you what they were yet, but
Okay.
good
I
job.
couldn't remember. Okay, sorry, guys.
All right. Now I'm going to assess your cranial nerves. So first I'm going to assess your first cranial nerve by using my, your first cranial nerve is your olfactory nerves. I'm actually going to assess your sense of smell. So I'm going to have you close your eyes and I'm going to put something in your nose and go ahead and smell that. What do you smell?
It's like
You smell it?
all the clothes are
Do you still
gum.
Yeah, gum. There you go. Okay, perfect. So she's able to smell the gum, so her olfactory nerve is intact. I mean, she kind of smells the gum. It's a little scary. Okay, can you taste? Are you okay to taste?
Yes.
Okay, good. All right. So her first cranial nerve is intact. We're going to wait to do the second cranial nerve, which is your optic nerve. We're going to go to your third cranial nerve. So for this, I'm going to take my pen light. What do you think the easiest way to do this? There we go. Okay, yeah. So I'll turn this way. So I'm going to take my pen light going out and looking at her pupils. Perfect. And same on this side. Okay, they constricted. All right, now I'm just going to have you blink a couple of times. Okay, perfect. Now I'm going to test your peripheral vision. Tell me when you see my pen light.
Right.
Okay.
Right there.
Perfect. So they were equal on both sides. And since I'm at her eyes, I'm just going to test for perla. So her pupils, they're equal, they're round, they reacted to the light with my pen light. Now I'm going to see if they can accommodate. So I'm going to have you look close at here and then look far away at the wall and then look back. Perfect. And her pupils dilated, so they did accommodate. All right. Now I'm going to test your eyes level of convergence. So go ahead and keep your eyes on my pen light. Perfect. And she was able to go cross-eyed. Now I am going to assess your, so now we're going to assess your fourth and sixth cranial nerves, which for those we're going to do the cardinal fields. So go ahead and keep your eyes on my pen light. Up, down, over, here, this way. Perfect. Okay, awesome. So her extraocular eye movements are intact. She was able to do those. All right, so now I'm going to assess your fifth cranial nerve, which is your trigeminal nerve. So I'm going to go ahead and open and close your mouth for me. Any pain or tenderness there? Go ahead and clench your jaw.
Mm-hmm.
Any clicking? No, perfect. So no signs of TMJ. All right, and then also for your trigeminal nerve, I'm going to have something soft and something hard. I'm going to have you close your eyes and tell me when you feel me touch your face with something hard or when I touch your face with something soft.
Hard. Soft. Hard. Hard.
Perfect. Okay, so that nerve is intact. We're now going to go to your seventh cranial nerve. So can you raise your eyebrows for me? Can you frown? Smile? Puff out your cheeks?
Sorry. Have it.
Puff out your cheeks. Okay, perfect. All right, now we're going to go to your eighth cranial nerve, which is your vestibulocochlear nerve. So if you could just scooch up that way for me. All right, so go ahead and cover one of your ears. I'm going to whisper a set of numbers. You repeat them for me.
61.
You don't have to whisper it too. Okay.
891.
Perfect. Okay, so her vestibulocochlear nerve is intact. We're now going to go to her 9th and 10th cranial nerves. So for this, can you go ahead and swallow for me? So I can see she swallowed. Perfect. Now I'm going to take a tongue depressor. I'm going to place it on your tongue. Go ahead and say ah.
Uh,
Okay, so the soft palate moves so perfect. And then also I'm going to test your gag reflex. Okay, perfect. And she was able to gag, so we're perfect there. Sorry about that. Okay. All right. Now I'm going to assess your 11th cranial nerve. So go ahead and shrug against my hands. Perfect. Okay, so your 12th cranial nerve, we're going to, I don't know my theory, is your hypoglossal nerve. So go ahead and stick your tongue out, move it side to side. Okay, and then can you turn against my hand? And then same on the other way. Perfect. All right, so those are your cranial nerves. Now we're going to go back to your second cranial nerve, which is your optic nerve. I'm going to have you stand up. And then I don't have a Snellen chart, but I'm going to explain one. So there would be a chart right there with a set of letters. So your, I'm going to close it. I realized I didn't do that. Okay. All right.
It fell over.
Oh no.
Sorry. Hopefully that's good.
It's good. It should be, hopefully, maybe.
I think so.
A little more straight, maybe. So hopefully you can see us, Pam. Sorry, technical difficulties.
Okay.
Alright. So with the Snellen chart, she would stand right here, and there's two numbers. The top number is a fixed number. It's 20 because we're going to be standing 20 feet away from the chart, and the bottom number is based off of how small of the letters she can read. So I'm going to have her look with both eyes and read the smallest line. Then I'd have her cover one eye, read the smallest line she can read, and the other eye, and then read the smallest line she could read, and then assess based off of the findings there. Alright, so we've got the optic nerve check. Now we're going to do your height and weight. So I don't have a scale or a measuring thing. Height, what's that called? I don't know. Anyways, with me in my apartment, but I'm just going to ask what her baseline height and weight are.
160, and then I'm 5'8".
Perfect. Okay, so those are proportionate with each other and with her body build, so we're good there. Now we are going to do her, test her gross motor function by doing and balance and coordination by doing the Romberg test. So go ahead and stand facing me. I'm going to place my hands here. Go ahead and close your eyes. Sight swing is normal. Excessive swing is not perfect. Okay, awesome. Now I'm going to test your fine motor skills. Can you touch every finger together for me? Perfect. All right, now we're going to do your range of motion. So go ahead and follow whatever I do. So just copy me. Other one.
Oh, my bad.
Okay, go that way. Go backwards. Go that way. Okay, now let's do this way. Go up, back, side, and that way. Okay, now you're going to do your arms. Go out, up, down, flex, and out. Perfect. Okay. So now that we've got your range of motion, we're going to look at your spinal curves now. So go ahead and turn that way for me. So I'm going to assess from the side, looking at her spine, making sure it's nice S shape. Perfect. And there's no signs of kyphosis or lordosis. So now I'm going to check from that. Go ahead and touch your toes for me. So her hips are aligned. Her spine is nice and straight. Okay, you can go ahead and stand up. No sign of scoliosis in her spine. Perfect. All right. So now we're going to go ahead and do your vitals. So I'll have you go ahead and sit down right here. Okay, do you remember the 3 words?
Shoot, I even repeated them. Cat, rabbit, doll.
Good job!
Cat, rabbit,
there
doll.
you go, there you go, perfect. Okay, so I would document that her memory is great because she was able to memorize those 3 words and repeat them back to me at a later time. All right, now we're going to take your vital signs. So first I'm going to take your temperature. I don't have a thermometer with me, but I'm just going to verbalize how I would use the sublingual thermometer. So I just place that under her tongue, and then close your mouth, and then hold it until it beeps, okay? And then I would read her temperature and normal finding. Do you know your baseline?
Like 97.6.
Okay, perfect. So I'm just going to document that. Okay. All right. Now I am going to take your blood pressure. So I'm going to get my handy dandy blood pressure cuff. Is this arm okay to use? Okay, perfect. Alright. And then I'm just going to under here, making sure that the arrow lines up with the brachial artery. Okay. This. Oop. Sorry. This here. Okay, sorry about
You're
that.
supposed to clip it up.
Yeah, I am. Here's mine's different. Okay, there we go. Alright, now I'm going to get my stethoscope. Make sure that it is turned the right way. Perfect. Okay. Oop. Alright, so I got 118 over 78. Your blood pressure, is that pretty normal for you? Alright. Yeah. Okay. I'm going to get your pulse. I need my watch. Sorry about that.
Good shot.
Okay, so I'm going to feel your pulse. Okay, so I did her pulse and her respiration simultaneously at the same time, just so that the patient would breathe normally for me so that they wouldn't know that I was taking the respiration. So her pulse was 72 and her respirations were 16. So those are great. Those are in the average parameters which we want. So we go ahead and document those. Alright, perfect. Okay, so you got your, oh, and then blood pressure. Perfect. Alright, so you got your temperature, your pulse, your respirations, and your blood pressure. So now I'm going to assess your level of pain. So are you experiencing any pain anywhere?
Kind of my stomach a little bit.
Alright. So I'm going to use the PQRST method. So do you have anything that provokes your pain?
Really fried food.
Okay, and then what is the quality of your pain? Is it sharp? Is it dull? Is it throbbing?
It's pretty sharp.
Okay, alright, and then does it radiate anywhere in your body or is it just your stomach?
It kind of starts going up a little bit.
Okay, and then what is the severity of your pain on a scale of 1 to 10, 10 being the worst?
Probably a 5 after I eat.
Okay, gotcha. And then how long does the pain last once it hits?
Like a few hours.
Okay. Alright, so I have finished taking her vital signs. Now I'm going to move to her head. So I'm going to first look at the hair and the scalp. I'm going to inspect them, making sure that there's even hair distribution, no signs of alopecia. The scalp is a nice light pink to white color. There's no scaliness, there's no lesions, and nothing like that. Now I'm going to palpate. Alright. No bumps, no tenderness, any pain or discomfort? Okay, perfect. Alright, now I'm going to move the scalp, making sure it's freely movable. Perfect. Okay, now I'm going to assess the skull. So I'm looking for symmetry, making sure it's nice and symmetrical, making sure that, like I said, there's no lesions, there's no lumps. Now I'm going to palpate the skull, feeling for any lumps. I should expect to feel more of bony prominences in the frontal and the parietal areas of the skull. And then I'm going to make sure her skull is symmetrical, and if there were any areas that were smaller than the other, I would be sure to measure the skull's circumference. Alright, now we're going to move to the face. So I'm going to just inspect her face, making sure that there's no signs of edema. Her face is nice and symmetrical. She doesn't have any abnormal facial movements or tics. Then now I see her eyebrows and her eyelashes are evenly distributed. There's no abnormal hair growth on her face. Now we're going to move to her eyes. So we already tested for perla and her extraocular eye movements. So now I'm just going to assess her eye structure. So I'm looking at her eyes. Her pupils are equal, her irises are equal. Her irises are not exactly the same color, and that's totally normal. Her sclera is nice and white. Her cornea is clear. I'm going to go ahead and lower your bottom lid. Okay, her conjunctiva is a pink to red color, which is what we want. Her lids are sitting well in her eyes. There's no sign of ptosis, and they're not too red. They're nice and pink. They're well vascularized. Her eyelashes are evenly distributed, and they do curl outward. Okay, now we're going to, then I'm going to palpate her lacrimal gland. And any pain or discomfort? Any pain or discomfort? Okay, they're not swollen, and they look great. Now we're going to go on to the ears. So first I'm going to inspect the outer ear, and there's no lesions, there's no signs of edema, there's no lumps. I'm going to do the same on the other side. Okay, her ears are nice and pink. They are symmetrical on her head. Alright, perfect. Now I'm going to use, with an otoscope, I would inspect her inner ear. So what I would do for an adult, I'm going to lift up and back. For a child, I would lift down and back, but she's an adult, so we're going to lift up and back. So I would inspect her inner ear, and I would want it to look a pink ear canal, and then I would expect to see a fair to moderate amount of light yellow cerumen, and then also a pearly gray tympanic membrane, and then I would do the same on the other ear. Alright, and then now I'm going to palpate her external ears, feeling for any bumps, any tenderness. Okay, perfect. And alright, they are evenly distributed. Perfect. And I did test her hearing abilities when I tested her vestibulocochlear cranial nerve, so her hearing is intact. Alright, now we're going to go down to your mouth. So first I'm going to look at the lips, make sure that they are even, they're symmetrical, they're nice and pink, they're not too dry, they're not cracking, they look nice and moisturized. Right now we're going to look at your mouth. Can you go ahead and smile for me? Looking at the teeth, making sure that they are uniform in color. We're going to look at the gums, make sure that they are nice and pink, that there's no ulcers, no lesions on the gums. Go ahead and open for me. I'm just going to look at the teeth, make sure that she has all of her teeth. There's no signs of dental caries. Perfect. Alright, now I'm going to assess the tongue. It's nice and pink and it's nice and smooth. Okay, now I'm going to get my tongue depressor again. I'm going to inspect the hard and the soft palate. So go ahead and open for me. Okay, go ahead and say ah. Oh, my pen. There we go. Okay, so soft palates. Alright, I'm going to get you a little bit. Okay. And her uvula did move, so it's freely movable. Go ahead and open again. Her tonsils are not too swollen, and there's no signs of illness, no lesions, no bumps, nothing abnormal in her mouth. And all of her membranes are a nice pink color. Alright. Now we're going to move down to your neck. So I assessed your ability to swallow, so could you just go ahead and look up for me? Her neck is nice and symmetrical, there's no signs of edema, there's no swelling. I'm now going to palpate, making sure that the trachea is nice and aligned. Perfect, there's no masses. And I'm going to palpate your lymph nodes, which are generally non-palpable, and you can't really see them unless they're swollen. So those feel great. Any pain or tenderness there? Okay, great. Now we're going to go to your nose, so, and your sinuses. So I'm going to have you occlude one nostril at a time, check for patency. Go ahead and breathe in. Okay, and the other side, where either both of them, even in case you can breathe in and out with both nostrils, both noses. Alright, now I'm going to inspect her nose. Go ahead and look up for me. So I should see so that her nose is nice and pink on the inside. Her septum is not deviated. Light amount of drainage is normal. There's no lesions, no bumps, no obstructions. Perfect. Alright, and we tested your ability to smell with your olfactory nerve. Okay, now I'm going to palpate your sinuses. So there's no signs of edema, any pain or discomfort? Okay, about now. Perfect. Okay. Alright, so now we've got your head and your neck. Now we're going to move on to your musculoskeletal system. So I'm going to have you sit on the edge of the bed for me. So first thing I'm going to do is I'm going to test your patellar reflex. So I'm just going to, so I would have the mallet, yeah, and I would hit right about here on her patella, so I'm just going to use my hand for this purpose.
It's not hanging.
Did I get that one? Oh, okay. There we go. Okay, so we'll do the other one. Perfect. Wow. Okay, awesome. So her reflexes are great. I'm now going to inspect her musculoskeletal system. There's no sign of edema. There's no lumps or bruises. There's no lesions. Okay, I'm now going to palpate her muscles and her bony prominences. And then I'm also going to feel her joints for warmth over her joints. Is there any discomfort in your joints? Okay, great. And her bones are nice and even. And I'm also going to feel here. Perfect. Nice and even. Muscles are nice and strong. Alright, now I'm going to have you go ahead and squeeze my fingers. Okay, now can you pull me towards you? Can you push me away from you? Okay, can you push down on my hands? Go ahead and push up on my hands. Wonderful. Okay, now move down here. I'm going to go to your legs. Can you push down? Okay, can you lift up? Alright, and then with your feet, can you flex them? Perfect. Down here, push down. Great. Alright. Okay. Now, with your neck, I forgot to do one thing. I'm going to test the range of motion of your neck. So can you go ahead and look that way, then look the other way, look up, and look down. Great, she has great range of motion of her neck. Alright, okay, now we're going to move to your thorax and lungs and your cardiovascular system. So I'm going to kind of do those simultaneously. So first I would inspect for color of the thorax and the precordium. I would expect it to be somewhat similar to the color of her face. It might be a little lighter because it's not exposed to the sun as regularly. Making sure there's good vascularity, there's no edema, lumps, bruises, lesions, making sure that that is all good. I then would inspect the thorax, looking at the shape and the contour, making sure it's nice and symmetrical. I want to check and make sure that it is a downward slope going to the base of the rib cage. I then would inspect the cardiac landmarks, so the aortic, pulmonic, Erb's point, trigeminal, and tricuspid, there you go, tricuspid and mitral areas. And I would inspect those and make sure that I didn't see any pulsations except for on the mitral area, which the PMI, I may be able to see some visible pulsations, but I don't want to see them anywhere else. I'm also going to inspect the epigastric area above at the top of the sternum, making sure that there's no pulsations there either, because we don't want that. And we also want to make sure that there's no vein distension, no jugular distension, and making sure those are all good. Okay, now I'm going to palpate the thorax for any pain or discomfort. Do you feel any pain or discomfort? Okay, perfect. And then I'm going to do, turn around for me, sorry. I'm going to palpate back here as well. Any pain or discomfort?
Mm-mm.
Okay, perfect. So palpate. Okay, wonderful. All right. All right, now I'm going to palpate all of the cardiac landmarks, making sure I don't feel any thrills, lifts, or heaves. I want to make sure that the only place that I have palpable pulses is the mitral area. Okay, so I'm going to first do the aortic, and then I'm going to do the pulmonic, and then the Erb's point. Then I'm going to go to the tricuspid, and then the mitral. Let me get that mitral. Ooh, which I did feel pulsation, so perfect. All right. Now I am going to auscultate. No, first I'm going to percuss the lungs. Yeah. So now I'm going to percuss the thorax. So when I percuss, this isn't a skill that we're going to be thoroughly tested on right now, but I do need to verbalize percussion. So when I percuss over the lungs, I'd want to make sure that the sounds are nice and long, they're low pitched, they're hollow, and then if I were to hear any dull sounds that would indicate possibly fluid in the lungs or a mass, a solid mass, and then hyper resonance could indicate emphysema in the lung tissue. All right, now I am going to palpate the lungs for symmetry when she breathes in, and then also feel for vibrations when she speaks. So I'm going to put my fingers at between T9 and T10, and I'm going to have you breathe in for me. And my thumbs did spread apart, so perfect. Go ahead and breathe back in. Awesome. So she does have equal respirations. There's equal expansion also. And then I would also want to make sure that I assess and inspect that she does have equal respirations, inspiration and expiration, which is breathing. She doesn't have labored breathing. She doesn't there's not more expiration than inspiration, and she does have equal breathing. I'm now going to place my hands on her back. Go ahead and say 99 3 times for me.
99. 99. 99.
Perfect. Okay, awesome. So I did feel vibrations, so we're good there. All right. Now I am going to auscultate the thorax. So what I'm going to do, I'm going to start at the posterior sections, and I'm going to go in sort of a zigzag motion. So go ahead and take a deep breath every time you feel my stethoscope. Perfect. Okay, now I'm going to come to the anterior. Sorry, a little out of breath. All right, so I'm going to come to the anterior. Go ahead and breathe in. Sorry. Okay, perfect. So I didn't hear any adventitious breath sounds. There was no stridor, no crackles, no wheezing, and no pleural friction. So we didn't want to hear any of those, and I didn't, so it was good. Now I'm going to auscultate the I'm going to auscultate the cardiac landmarks. So I'm going to start at the aortic, and I'm listening for any for the rate, the rhythm, making sure there's not any different sounds. I don't want to hear any murmurs or gallops, so that's what I'm listening for. Go pulmonic, and we do the Erb's point. Sorry. We do the tricuspid, and then we'll do the mitral. Thanks. Perfect. Okay, wonderful. Now we're going to move to the abdomen. So I'm going to have you lay down for me for the abdomen inspection. So in a real physical assessment, I would first inspect the abdomen, making sure that there's no visible masses, there's no lesions, there's no visible peristalsis, no visible pulsations. Make sure that the umbilicus is central, and it can be concave, it can be, it needs to be round, it can be flat, or it can be rounded, making sure that all of those are okay. So first I would inspect, and then I would auscultate. So when listening, I want to expect to hear some bowel sounds. If I don't hear any bowel sounds in all 4 quadrants, then I would have to listen to each quadrant for at least 5 minutes. So I'm going to go ahead and listen to all 4 quadrants. Perfect. All right, and then the reason that I auscultate before I percuss or palpate is because I don't want to disrupt any bowel movements, and I don't want to cause pain to the patient. So now I'm going to percuss. So I would expect to, when percussing, okay, perfect. So when percussing, I would expect to also feel hollow and low-pitched sounds, except for over the bladder and the liver. I would expect to hear some low sounds because the liver could be full of urine, and the bladder, whoops, the bladder could be full of urine, and the liver is very dense. So I would expect to hear dull sounds for those. So now I'm going to palpate, and the patient said that they had pain in their stomach. So where's your pain?
Probably like right here.
Okay, so I'm going to palpate that last, making sure to be very careful so that the patient doesn't have any excessive pain. So I'm going to palpate, feeling for any distension, making sure that there's no masses. What? Okay, and then I'm going to palpate the area of pain last. Okay, perfect. So there's no areas of distension. It feels great. You okay? Yeah. All right, perfect. Okay, so now I'm going to ask you something a little bit uncomfortable, but it's okay. So when was your last bowel movement?
This morning.
Perfect. Okay, and then what was the consistency? Was it hard, soft, liquidy?
It was pretty soft.
Okay, perfect. That's what we want. Okay, what was the color? Was it dark brown, light brown, clay colored?
Brown.
Brown?
Just normal brown.
Perfect. Okay. And then how often would you say you had a bowel movement?
Once a day.
Perfect. And then is there any pain when you have a bowel movement?
No, pretty normal.
Perfect. Okay, awesome. All right. Now we're going to move on to the genital urinary system. So I'm not going to inspect this and assess this now, but what I would do is I would first ask the patient how often they void, how often they urinate.
Like every couple hours.
Perfect. And then what is the consistency? Is it the color, is it light yellow? Is it darker?
It's usually pretty light.
Perfect. And is it clear or cloudy?
Clear.
Great. All right, so since she answered light yellow and clear, that means that that is good urine. If it was dark, if it was cloudy, it could indicate some sort of sign of infection. And then I'm also going to assess the genital area, making sure that there's no lesions. Do you have any rashes? Any bumps? There's no pain when you urinate? No. Wonderful. Okay. All right, now last thing we're going to do is I'm going to demonstrate a breast exam. So I'm not going to actually give you one, I'm just going to instruct you on how to do it. So breast exams are very important. It's very important to do them once a month. So what you're going to do is you're going to stand in front of your bathroom mirror, bare chest. You're going to put your hands on your hips. You're going to look in the mirror at your breasts, making sure that they're symmetrical. It is normal to have one breast be larger than the other one, but it is not normal for them to have large variations of size. And then also want to make sure you're looking at the color of your areola, making sure that they're not too different in color. And then what you're going to do is you're going to put your hand behind your head, and you're going to palpate starting at the areola and then going in circles all the way around your breast up to your axilla, feeling for any lumps, any tenderness, making sure that we do that once a month because it's important to get to know what's normal for your body, and then making sure that you assess anything that's abnormal, any tenderness that you could let your physician know right away. And then going to make sure I did everything real quick. See if I forgot anything. And alright, I'm gonna go ahead and do some hand hygiene.
So Pam asked Brianna some questions.
Oh.
I don't know if this will count.
Okay.
If it doesn't, she could just mark it up. In your cardiovascular system, there's something that you need to feel for. There's, I don't know how to word this so that could be the answer. But there's 3 different, I don't know how to do it.
Lifts and heaves said that.
No, it's your.
Oh, I need your peripheral pulses.
Yeah.
Okay, go ahead and sit up for me.
That's like I don't know.
Sorry. Okay. All right, so I'm going to palpate your peripheral pulses to check for amplitude and symmetry. So first I'll do your radial pulses. So if you give me both wrists, I'm gonna just feel those at the same time. Perfect. They are beating at the same rate and are both a 2+ because I'm gonna rate that normal. They're not bounding, they're not thready, they're not decreasing, increasing. Great, now we're gonna do your carotid. I'm gonna do this one at a time. So first I'm gonna do, okay, now you're gonna do your left. That's your right side. Perfect, okay, so I'm also gonna rate those a 2+ because it wasn't bounding and it wasn't thready and it was a steady pulse. So last one I'm gonna do is your dorsal pedis pulse. So this one's a little bit harder to find, so I'm just going to, okay. Good. Okay, those are equal, and it is normal for those to be weaker because they are farther away from the heart. So I'd also rate those a 2+ because they were equal. I could palpate them, and yeah, okay. So I'm gonna do hand hygiene. Do you have any questions for me?
I don't think so.
Great. All right. Then I'd go document.
Okay.
Yay!
Was it not recording?